Welcome to Adapt NCLEX. NCLEX is content exams at the same time test taking strategy. When you know those, you're going to be safe. I have 10 questions for you. I use content to show you how you can navigate your way through any question. But stick around, look at what I'm going to do. If you would like to watch this video, you stop the video, answer the question the way you want, and then see the way I approach it. The first question is a simple, straightforward question, but it's loaded, right? It's easy to mix, right? Which finding the nurse you expect? The nurse is assessing 18-year-old female client with what? Chronic renal failure. The buzzword is chronic renal failure. What do you expect in a client with what? Chronic renal failure. That's all. Number one is anorexia. The kidney does not work, and all the chemicals give them anorexia. So they're not going to eat. In the process, they're not going to gain weight. You see, if they're not going to eat, most of the time they're weak. How can they be restless and then move around all the time? This is a trap. I know a lot of people will pick this. I will show you what answers a lot of people pick. And most people will pick restlessness because they heard it before. They say it's a priority. But it's based on the question. In a chronic renal failure patient, they're not going to be moving around, go all over the place. They're very fatigued. They're not going to move. They'll stay around. Their skin, if you look at it, is brown, black-like. It's because of all the chemicals. So this is not going to be pink. Hormonal changes will occur in the female with chronic renal failure, and they will have amenorrhea. Therefore, that's what you're going to see. Irregular menses. A very hard question. I use content to answer it. Which finding should the nurse suspect? Same thing, select or apply. A client with what right-sided heart failure, exacerbation is being assessed. How do you answer question? From the back, it's a select or apply. Second, what do you expect? Expected finding. That's what I write down. That's what I'm being asked to do. Expected finding and select or apply. What is my buzzword? Heart failure. What kind of heart failure? Right-sided heart failure. Therefore, what I need to do, rewrite it on my own. Right-sided heart failure. What should I expect? I should never see a pulmonary symptoms. Any lung symptoms is wrong. Therefore, pink fluid sputum is your lung. I don't expect it. Paroxysmal nocturnal dyspnea, right? Is your lung, right? Elevated fruity central venous pressure. So on the right side, right? Hepatomegaly, right side. Ascites, right side. Any lung symptoms is the wrong answer. These are the things you have to pay attention to. These are the things you pay attention to. And when you do that, you're going to master your NCLEX. So what do I expect? I see 3, 4, and 5. Those are the one I should expect. Next question. A client is diagnosed with peripheral arterial disease. That's my buzzword. After reporting intermittent calf pain with walking. Is irrelevant. What is the keyword? Buzzword. Peripheral artery disease. Which finding should the nurse expect? What would I see in a patient with the PAD? What is the key concept with PAD? Decreased blood flow. Therefore, your leg will see decreased blood flow. If there is a decreased blood flow to your leg, you get what? Leg toe ulcers. That is consistent with PAD because the toe is the last portion of your leg that will receive blood and is more likely to have ischemia. Browning pigmentation due to too much blood, edema. In peripheral arterial disease, I don't have too much blood. Wrong. Ankle edema is due to what? Too much blood. Capillary refill, less than 2 seconds means it's normal. Don't get that one confused. Capillary refill less than 2 seconds is normal. This you see in the venous problem. Leg pain relief with elevation. If you have too much edema, you elevate your leg, your pain is going to get better. You see this in venous condition. Atrophic skin, less blood going to my leg. That's why I see atrophic skin. Therefore, this is your right answer. 2 answers. Pick those you're confident. Don't overselect. Don't think you need to pick more. 1 and 6 are your right answer. You see what I'm doing? Which client required immediate intervention? Select all that apply. You have to be sharp. What is be sharp? Breathing, electrolyte shock, sepsis, airway, and pain. All of them, you got to assess them and see if it's a problem. Multiple patient, assess them and see who you need to see. 1 second. Asthma, heart rate of 110. This, they are not having respiratory issue. Expected finding. Post-kidney biopsy with the MAP of 75. That is not shock. MAP of 75 is normal. Client with back pain 2 hours after cardiac catheterization. That is bleeding. This is shock. You have to be sharp. A client with calf pain 6 hours after pelvic surgery. That is DVT. You have to know these signs. This is bad. A client on levothyroxine with low TSH. If you're on levothyroxine, you're going to suppress your TSH. Expected finding. Who do you see? Cardiac catheterization and a pelvic pain, pelvic surgery, and calf pain. So 3 and 4 are your right answer based on content. Which finding should the nurse expect? Selected apply. Same thing, bunch of selected apply. If you watch a Dr. NCLEX questions and practice them, you see all of them selected apply so that you become more confident. They also very critical thinking questions. 3 weeks old infant seen in emergency department for projectile vomiting for 2 weeks and is diagnosed with what? Pyloric stenosis. A bunch of words, 2 sentences. Don't worry about it. Ask yourself, patient has what? Pyloric stenosis. That's all. If I have pyloric stenosis, what would I see? Go back with your content. Select or apply. What do you think? If you're vomiting, your abdomen is going to not be distended because you have what? Pyloric stenosis. There's obstruction in the pylorus. It does not go into your stomach. So you have something like that. An obstruction here, not through obstruction, but hypertrophy. So you cannot have distended abdomen. But you're going to feel this as a mass, palpable mass on the right upper, right side of the umbilicus. Since you're vomiting, you're going to vomit all your acid, you become alkalotic, you get dehydrated, and you lose your potassium through your kidney. Hyperkalemia is wrong. When you vomit, there's not going to be bile in it. It's going to be what? Non-bilious. Bad problem. Wrong answer. Since you're vomiting all your acid, you're not going to be metabolic acidosis. You have metabolic alkalosis. Pick those that you're confident based on your content. Only 1 answer. Number 2 is the only answer there. Be careful for these kind of questions. Okay. Next question. Which client statement require immediate intervention? A nurse is providing discharge instruction to a client with celiac disease. Content, celiac disease. What should they worry about? What should they avoid? Or what should they eat? What should they eat? Brown. What should they avoid? CPR. What do you mean? B, barley, R, rye, O, oat, W, wheat. They can eat what? Corn, potato, and rice. Therefore, I will read food label. It's a good thing so that I know I'm not eating anything with the gluten in it. I will have to fortify wheat. You cannot eat wheat cereal, right? I will need vitamin E because of the loss of what? Nutrition, vitamins, ADEK. They will lose vitamin fat soluble vitamin, ADEK. So you got to be careful. You got to supplement it. I will buy some hot dogs on my way, some diet that may hide brown in it or gluten in it, but they don't tell you. One of them is hot dog, so they should avoid. So which one need intervention? What do you think? Based on what the way I explain it, this guy, they need to intervene. Which finding is most concerning? A client prescribed Statin 2 months ago, returned to the clinic for evaluation. Which finding is most concerning? You take a statin, priority function is damage to your muscle. And how do you call it? Myopathy. Your LDL is going down, it's a good sign. Your glucose is going up, it's bad. It's not a good sign. It's a side effect of the medication, but it's never a priority. AST is going up, it's never a priority compared to what? Myopathy. So number 4 is your right answer. Which of the following teaching point should the nurse provide? A client is being discharged with a new diagnosis of what? Addison. What is Addison? They don't have steroid because what the adrenal gland is shut off. So they need steroid the rest of their life, right? What the teaching do you provide them? Jogging exercise is good. Why? Because it reduces stress. Stressing them will trigger more steroid. They cannot make steroid. It become a problem. So that's the right answer. Take steroid as needed. You take steroid the rest of your life, every day, not PRN. Add salt substitute to your diet. If you look at the electrolyte of adrenal gland, their potassium is high, sodium is low, glucose is low. Salt substitute contain too much potassium. They cannot take potassium. So that's the wrong answer. Increase steroid dose before any surgical procedure? Yes, because of the stress. See a dermatologist for bronze pigmentation. The bronze pigmentation is because of the ACTH that is high. You don't need a dermatologist for that. Therefore, which teaching point should the nurse include? Reduce stress, avoid this and that, increase your steroid. That's all. 1 and 4 are your right answer. You see how these questions are content-based and test-taking strategy. Which of the following finding is the most concerning to the nurse? A client with myasthenia gravis present to the clinic for 3 months follow-up. Which one is concerning? Buzzword, myasthenia gravis. What do you need to worry about? Expected finding, let it go. Non-expected finding is your priority. Fatigue at night is consistent with myasthenia gravis. Double vision, consistent with myasthenia gravis. They may have bladder incontinence, consistent with myasthenia gravis. Change in voice, dysarthria, swallowing problem, a priority. Number 4 is your boy. And the last one, and this is caring for several clients who should be seen first. Prioritization 101. Acute lower quadrant pain and fever, appendicitis. Let's see if there's anything there. Right upper quadrant pain and fever. They are all infectious, sepsis. But what do we have? Morphine every hour. After cast, you're going to lose your limb. This is what? Compartment syndrome. I'm using the B sharp for you. Severe frank pain radiating to your groin. This is a pain. It's not going to kill you. You're not going to die from it. It's kidney stone. I have a kidney stone with the pain. I'm not going to die from it. I have morphine every hour after cast. I have compartment syndrome. I'm going to lose my what? Limb. They all have pain, but look at the pain. It's different. Pain with the fever, cholecystitis. Pain with the fever, appendicitis. Pain every hour, requiring morphine. I'm losing my leg. Pain going to my groin is kidney stone. Who do you need to see? Number 3. If you need more, check Adapting class. If you want more, subscribe to our channel. You get more like this. And what? You can join our membership or the incoming crash course. Take care of yourself and best of luck.